Today we are going to discuss the Affordable Care Act and the many things that you may or may not have heard concerning it. We are going to give a brief summary of what the law is, what it is intended to do, and how it has affected individuals, businesses, and insurance companies so far. When the bill was introduced, you probably heard some of the more popular comments made by governing officials repeated many times. Nancy Pelosi was the prominent speaker for the law and was quoted saying, "We have to pass the bill so that you can find out what is in it." The president has also been quoted saying many things along the lines that you would be able to continue your current medical coverage and maintain the same doctor. So, what exactly is the Affordable Care Act? It is the most commonly referred to as Obamacare. It requires all Americans, with just a few exceptions, to have health insurance. It was to be fully implemented by 2014, but has since been extended until 2015, and some provisions have been extended all the way to 2017. That consists of approximately 2,000 pages, and the regulations associated with the Act are comprised of approximately 20,000 pages.
The bill was intended to help individuals who may find themselves unable to obtain health insurance or were simply unable to afford it. Before the Affordable Care Act, an insurance provider could opt to terminate your coverage if you were diagnosed with an illness of any sort that may cause them to lose money from your policy. Most young adults remained on their parents' policy until the age of 25 prior to the Affordable Care Act. That has now been changed to age 26. It is a commonly mistaken fact that with Obamacare there will be no more co-payments. This is not necessarily true. While most preventative tests and screenings are fully covered by an insurance policy, doctors may charge for visits or for co-insurance. Previous policies only offer a certain monetary amount of coverage. Once that amount is reached, most companies terminate the policy of the customer, but with the Affordable Care Act, no provider is permitted to eliminate coverage because of the amount of compensation given. Even though the law was designed to help Americans obtain health care in a relatively simple and affordable manner, much criticism is being placed on its limitations. One of Obama's promises to the American public was that we would be able to continue seeing the doctors we have seen for years, but many sources are proving that claim to be false. Those who have insurance through the Affordable Care Act are only able to use doctors within their network coverage. This usually limits consumers to a small range of practitioners, in most cases not including their preferred doctor. Since the opening of the marketplace last October, young men are experiencing 97 to 99% increases on their premiums, while young women see 55 to 62% increases. The marketplace was designed to help the poor obtain insurance, but those who don't fit into the poor or rich categories are finding it difficult to afford the new premiums. Because of the strict regulations and ordinances put in place by the Affordable Care Act, many insurance providers have been forced to terminate some of the plans they offer. Over 12 million policies were terminated by insurance providers since the opening of the marketplaces. If you're a tobacco user of any sort, you are also subject to 50% increases in premiums. This sketch is one of many that heavily criticize the broken promises President Obama has publicly made. After the implementation of the law, many individuals begin to stumble upon the reality that these promises are just not true. This sketch only portrays one of the many issues citizens are seeing. Though the law was intended to be helpful, it seems to be causing more harm than good for many consumers. The law hoped to expand coverage beyond what current policies provide, and they have to meet minimum standards. Services included for individuals by the ACA include ambulatory services, emergency services, hospitalization, maternity and newborn care, mental and behavioral health care, prescription drugs, rehabilitative services, laboratory services, preventative care and chronic disease management, pediatric services, including dental and vision.
Many of these services were already standard with the insurance policies that consumers already had. However, the Affordable Care Act is seeking to make these services as a minimum standard for all insurance policies. The Affordable Care Act has one substantial rule that has caused many employers to drop their coverage. Under the new law, the for-profit side of the industry will receive subsidies for the cost of the new plans and extended coverage. The nonprofit sector of the industry will receive no subsidies and are actually classified into the Cadillac plans that call for a 40% excise tax. This has caused many employers to drop those plans regardless of the numerous benefits provided by the plan. Many employers found themselves having to shop on the new exchange to meet the new law requirements. A major reason for this type of policy is, of course, driven by money. The starred companies above, Aetna, WellPoint, United Health, Humana, and Cigna, Also, some of the largest for-profit companies in the industry spent almost $50 million lobbying Congress and the main lawmakers shaping the law. Some of these lawmakers who created the Affordable Care Act actually worked in the for-profit sector at one point or another. This has created even more bias during the compilation of the ACA. The for-profits companies are expecting more in return for their money that they spent lobbying Congress. They are actually expecting to earn between 10 and 35 billion over the next 10 years. Even though insurance companies such as Aetna have boasted that they have already begun shaping their policies to meet the new standards set forth by the law, they have much to gain with passage and implementation of the law. The integrity of the company may be at risk considering how much they expect to gain and how much they invested in ensuring that the law passed. Some background data concerning the subsidies are that they are actually considered risk corridors. It is one of the obscure pieces of the Affordable Care Act that is intended to stabilize the insurance markets as millions of previously uninsured customers enter the system. The provision lasts 3 years and applies only to companies offering plans on healthcare.gov and state-run exchanges. If those insurers pay out much more in medical claims than they anticipated when setting premiums, the government will backstop some of their losses. Some lawmakers, such as Marco Rubio, have pointed out that it would be theoretically possible that only really sick people will sign up for coverage in the exchanges, and insurers will wildly lowball their premiums. This type of scenario would cost the government billions in bailout money. They also acknowledge that the government has limited experience with this type of program and that there are so many uncertainties about the market and the health insurance and how it will function under the Affordable Care Act that it is difficult to assess the risk and the implications that it may cause and how much it may actually cost the government. What if your plan was dropped? Would you qualify for Medicaid or would you have to shop the exchange? Look at this chart on this slide. You can see that for a family size of 4, the monthly income allowance is $744 to qualify for Medicaid. If you find yourself making more than $744, married individual with 2 children, you will be forced to shop on the exchange. Would you be able to afford the policies offered on the exchange? The bronze level, which is the lowest offer on the exchange, costs a 50-year-old non-smoker about $307 a month. The silver plan, which is a step up, is $381 a month. People older than 50 are expected to pay more for insurance, while younger people are expected to pay less. For example, a bronze plan in Alaska would cost a 50-year-old $553 a month, while it would cost a 27-year-old $325 a month. And if you found yourself shopping on the exchange, would you qualify for a subsidy? The subsidies taper out at 4 times the poverty level, which is about $95,400 for a family of 4 this year, or $46,700 for a single person. About 6.2% of the remaining U.S. uninsured population has incomes above that level, according to a June study by the Urban Institute in Washington. The insurance companies seem to have everything to gain and nothing to lose, with their losses being backed by a subsidy program. Let's look at how the new healthcare law is affecting employers.
A small business is defined as a business that has less than 50 full-time employees. Today, almost half of uninsured Americans are small business owners, employees, and their dependents. An advantage for small businesses is that they are not required to provide coverage for their employees. A disadvantage for a small business is that companies are having to cut back employee hours, and they are also reducing hiring and passing costs associated with the act onto the customers. A large business is defined as a company that has more than 50 full-time employees. The companies that do not already offer health coverage will be impacted the most. There are not many benefits for large businesses, but due to recent changes, they will not be required to implement the act until 2015. A disadvantage for large businesses is that they must provide health benefits to all 30-plus hour-a-week employees. Also, they can be fined for many different violations. If they do not offer any coverage, they may have to pay $2,000 per employee after the first 30 employees. Another violation they may have to pay for is if the plan that they offer costs employees more than 9.5% of their yearly income, the business may have to pay a $3,000 fine per person. An example of a large business that has been affected by the ACA is Walmart. On October 6th, Walmart announced that their partnership with DirectHealth.com. With DirectHealth, they will work together to help customers find best options and plans for them on the ACA exchanges. Also, to help customers, Walmart has implemented a $4 30-day supply of generic drugs, and they plan also on having a Minute Clinic type facility in their stores. Then the day after Walmart announced their new partnership with DirectHealth that seemed like it'd be a good idea, they announced that they would be decreasing coverage for 30,000 part-time employees, and they'd also be raising the premium for all their full-time employees. It seems like Walmart is doing everything it can to help its customers, like finding plans for them, offering cheap medication, and a Minute Clinic in the store, but they are not really doing much for their own employees. It seems a little ironic that Walmart is partnering with DirectHealth, who helps find people medical coverage, when they just terminated 30,000 employees coverage. It can be assumed that DirectHealth will attempt to get these employees to come over to them for help. This means that Walmart and DirectHealth will both profit from this due to their partnership.
Based on UCLA Law Review, the law requires revisiting, which will most likely result in revision. This is based on the law's exclusion of many people that have entered the country legally and also pay taxes to help contribute to those subsidies which are offered through the law. Michigan Law Review has also stated that the free rider problem, which existed before ACA passed, has now been shifted to what they call a Robin Hood problem, which makes the taxpayers pay more or pay for those free riders just the same as it had before. It also talks about cost shifting and cuts to Medicare to fund the Medicaid expansion, which essentially takes benefits from the elderly and gives to the younger individuals.